Hello to all students. In this video lecture, we are going to discuss a disease which is known as Myasthenia gravis. Myasthenia gravis is a neuromuscular disorder which is a long-term problem, long-term disease. And this disease is usually a result due to the autoimmune disorder. There is a immune system which works to defend our body, but sometimes it happens that our own immune system backfires on its own body and causes certain conditions which are known as autoimmune disorder like lupus and many other type of disorders. Autoimmune disorders usually do not have any permanent cure. So we have to be very careful about these diseases. So first of all, we are going to discuss some symptoms which can be used to diagnose Myasthenia gravis. The major symptom is the weakness of eye muscles, which is known as ocular myasthenia. Due to that condition, muscles of the eyes or face or any part of the body becomes very weak, and they have inability to contract completely. Due to the weakness of the eye muscles, drooping of one or both eyelids can take place, as you can see in this diagram. This eye is normal, but this has drooping in the eyelid. Blurred or double vision, which is known as diplopia, due to the weakness of the eye muscles. Change in facial expression. If the muscles of the face become affected by this condition, then the expression of the face can change from a normal expression to a very weird expression. Difficulty in swallowing. If the muscles of the throat becomes weak, then it becomes very difficult to swallow liquid or solid food. Shortness of breath, impaired speech, which is known as dysarthria, fatigue, and difficulty in walking and doing some other activities of daily life. So if we see these symptoms in a patient or in a person, then we go through some blood test and some neurological tests to confirm Myasthenia gravis. So now we are going to look at what is the physiology of this disease. So if we look at this face or this person having Myasthenia gravis, due to this disease, the left eye of the person has become weak and eyelids are drooping. So I have taken a small piece of muscles of the eyelid over here. You can see the muscle cells. Remember that whenever our body wants to contract and relax any muscles in our body, especially the skeletal muscles, it is controlled by our nervous system. Certain neurons from our brain and spinal cord reach at those muscles, and according to the message or nerve impulse from our central nervous system, that muscle is able to contract. There is a junction between the muscle and the neuron, which is known as neuromuscular junction. So this is the terminal end of a neuron which is coming from central nervous system, and it is a knob-like structure. This knob-like structure has a membrane which is known as presynaptic membrane, and there is a postsynaptic membrane which is the other neuron which is attaches to the muscles. Between these two membranes there is a gap which is usually known as synapses. For muscle to contract, it needs to receive a message from nervous system which comes through neuron towards muscles through synapse. So what is the mechanism when a nerve impulse starts coming towards a muscle? It reaches at the terminal end of the neuron where synaptic vesicles are present which contain neurotransmitters, especially acetylcholine in this case. When a nerve impulse reaches at the terminal position of a neuron, synaptic vesicle attaches with the presynaptic membrane of the neuron and releases the neurotransmitter known as acetylcholine. In the normal process, these neurotransmitter attaches with the receptors which are located on the postsynaptic membrane of another neuron through synapse. In this way, a nerve impulse passes from one neuron to other neuron and ultimately to the muscles, resulting in the contraction of the muscles. But in the condition of myasthenia gravis, there are certain antibodies in our system, neuromuscular junction, which block these receptors. So these purple color structures are known as antibodies and the brown color structures are blocked receptors by these antibodies. These antibodies are usually Ig, G1 and G3. As a result of these, partial contraction of muscle takes place. If you look over this section of the diagram, these are the neurotransmitter which are allowing nerve impulse to pass through, but these blocked receptors by antibodies are not allowing neurotransmitters to transmit through these synapses. As a result of, some part of the muscle will contract while other will not contract. As a result, myasthenia gravis will take place and a person having weak muscles or incomplete or partial contraction of their muscles anywhere in the body, especially in the eyes or the face. So if we look at the causes of this disease, so most important cause is autoimmune disorder, as I mentioned earlier, including antibodies IgG1 and IgG3 which are involved in this kind of condition. But sometimes thymus gland also involves in the presence of this disease. So as I mentioned earlier that this disease does not have permanent cure. So what we do, we only treat with certain medication to improve the symptoms of the patient. So there are certain medications which can be used by specialist doctors which deal with the autoimmune disorders to help treat the symptoms of any kind of autoimmune disorder. So treatment include anticholinesterase, which is usually in the form of mestinone to treat such symptoms. Thymectomy, removal of the thymus gland if the thymus gland is causing problem of this disease, and sometimes immunosuppressive drug like prednisone can be administered to treat the symptoms of this disease. So I hope it makes sense, and that's all for today. See you in the next lecture. Until then, bye.